Hi, this is Rahul Guha. I'm an epilepsy specialist in Lynchburg, Virginia. This law empowering school personnel or anyone that comes into contact with students regularly, empowering them to take care of patients with epilepsy. Epilepsy is a very stressful condition, and there's not a great time to have a seizure, but certainly, and the school age is a particularly stressful time when there's already a lot of different pressures and a lot of expectations, but also it's a time where you want to feel safe and comfortable so that you can learn and grow.
The Jamie and Brie Strong Act for Seizure Safe Schools was signed by Governor Northam last year, and it provides seizure first aid training and recognition for all school personnel and staff.
So it was signed into law last year, and it's being implemented this school year. It is biannual training provided for free online by the Epilepsy Foundation, and it is about an hour and a half long to take. And this year, with our school district, I know that training was required to be completed by last month, which was by July of 2022. So when the school year starts, all school staff in Virginia Beach City Public Schools should be trained in seizure first aid and seizure recognition.
And so it's a really important step in our state. We'll be able to give students and parents and teachers the comfort and support they need to make sure that they are successful. So in the clinic, it's routine that I come up with what's called a seizure action plan. It gives people the confidence of what to do in a very stressful, often dramatic, unpredictable, and dangerous situation. For these kind of seizures that's individualized, because not everybody has the same kind of seizures, but we develop individualized seizure action plans. One of the tenets of the law says that the seizure action plan must be available on hand for every single student. And the other thing is that there is additional training, because not everybody is necessarily familiar or comfortable with managing a seizure. It can be very scary if you're not in the medical field, and it's even scary if you're in the medical field. So the Epilepsy Foundation, in accordance with CDC guidelines, has come up with a free online module. The law says that this module must be completed every 2 years, and there must be maintenance of certification for anyone that interacts with students. And so in addition to kind of knowing how to take care of all seizure patients, you are able to use that with the individualized seizure action plans, which should be documented for every individual. And finally, it allows a Good Samaritan law protection for those bystanders who must come in and apply first aid in a seizure situation. The biggest challenge in communicating seizure action plans is taking a step to understand literacy level. And so if all of your education is something that is written on a piece of paper and you just hand it to them and they walk out the door, that's not always the most effective technique. And so it is good to have audiovisual resources, especially for younger people who are more comfortable or consume educational material that way. I mean, everyone gets papers when they go to the doctor's office, and they end up in the bottom of your car, right, for months. And so that's not really something you want. So the most effective approach for getting these fundamentals kind of drilled in is repetition and using as many different mediums as possible. And so, that's what I ask people to do, I try to refer them to good resources and videos, hopefully videos like this, and that way they can, reinforce the fundamentals. Absolutely. And that's a big part of the counseling we do during the first visits in our clinic. We want people to understand, we talk about what a seizure is, what to do, when to go to the emergency room, and everyone has their sort of style and their approach to that conversation, but it really is a good opportunity to understand what the individual patient's comfort level is with the condition, and make sure that they're all at least able to manage the most urgent situations. And so I it's essential. It's an essential part. We've standardized a lot of that work in our clinic. We have templates that we work through with our electronic medical record. Our nurses are all familiar with having that conversation. Even the folks who answer the phones know how to talk through a seizure first aid for seizures. So that's a really great opportunity. If you take care of these patients, standardize it. If you're not sure what the standards are, go to the Epilepsy Foundation or reach out to anyone. Reach out to me. I'm happy to help you talk through and share the work that we've done here.
So Brie was diagnosed with epilepsy when she was 7 years old. It was right before she started second grade, I think it was. And it was a learning process for our entire family. This was very new, and we knew that this journey was going to bring about challenges. So just educating ourselves as well as her school on the condition of epilepsy, and having good communication with her teachers, the nurse, and also the staff at school that would be involved with her, really had helped with the process of this journey of epilepsy. And she can tell you that having that support system at school was very vital in succeeding in school. There was struggles to begin with because of adapting to what epilepsy is about, medications and things of that nature. But having, going into school and just being close to her teachers and who's going to be involved with her, being able to be open about her condition, and again, communication was the biggest factor in her success at school.
Yeah, being able to have really good teachers and a good friend group that knows my situation and then always helped me through it if they knew something was going on, and always having supporting teachers, if they knew, they always helped me out.
If they think she might have been having maybe a tough day, just again, communication is key. Just helping her advocate for herself as well. Elementary school was a little different because she was younger, and of course, when she entered middle school, we said, we're going to give you a little bit of control of who needs to know. And so of course, school staff would need to know, the nurse would need to know, but she entrusted, maybe one or two friends, and her teachers have been very supportive. Middle school was different because the pandemic started when she's halfway through middle school, so that was kind of a challenge of not being face to face and having that support system. However, her middle school was so great in keeping communication and also being knowledgeable of epilepsy. So that's what Seizure Safe Schools is all about. We have people, talking to us saying how important it was, how epilepsy has affected them in some way, shape, or form, right? Epilepsy has affected them, whether it's a family member or a friend. It's great to have that open communication.
Unfortunately, I don't always meet people when they've had their first or second seizure. And, you hear a lot of stories where individuals, because of a delay of care or uncertainty that occurs, unfortunately, people can get injured, get hurt. People can get CPR inappropriately. They can get, essentially, harm can come. And so you really don't want to hurt someone any more than they actually do. But, with epilepsy, there's a lot of stigma and a lot of superstition and a lot of myths surrounding the condition itself and what to do during a seizure. And so having a standardized, agreed upon educational system prevents injury and harm that I've seen. And, I don't need to go into specifics, but I'm sure everyone has those stories. The kind of thing of, putting something in someone's mouth so they don't bite their tongue. I mean, that's kind of a classic old wives' tale where you actually are more at risk of swallowing the thing that's put in there or biting someone's finger than, just sort of letting them make sure that the airway is clear and turning them on their side. And so these little things, in a stressful situation, you don't always have the ability to think cognitively. And so if you can rely on good training, then it becomes instinctual and it's much safer for patients. And so when someone has a seizure action plan, it's well choreographed, there's no comparison.
Teachers are not the only ones who can take the training. You are also able to take seizure first aid training. You can go on different websites to take it, and
Just the Epilepsy Foundation
Yes.
website, yeah, just one website. But what she meant was the different levels of training is on the Epilepsy Foundation website, and they're, not just teachers are the only ones that can take it, but caregivers can take it. You can take it just to be more knowledgeable. It's just like taking a first aid course. It is online and it's very convenient. And again, there's different levels. There's one for school staff. There's one for just caretakers. Again, doing your research and being knowledgeable and also being aware of what's out there as far as resources definitely helps.
In my experience, if there's something that you don't like, it's either because it's not presented in a way that's accessible, and I think the materials are actually quite accessible, so I would say give it a shot. But really, in my experience, when people are unfamiliar with any medical issue, whether it's seizures or something else, it's just because they don't know enough about it. And so ultimately, if you increase your comfort level, then you in turn will become an advocate yourself. And so just think of it as another way for you another tool you can have in the classroom, another opportunity to connect with your students. And I think students will really appreciate that, parents will really appreciate that. And so I would say it's only going to make you a better teacher, so why wouldn't you use that resource? We've worked really hard to make it something that is useful.
504 and IEP, I believe the differences between the two, they both provide accommodations for your child. An IEP is more of a customized education. Brie is on a 504 plan at her school, and my recommendation is to get together with your medical team, put your seizure action plan in place, bring it to your school and to speak with your counselor and your teachers to better determine if a 504 or IEP is better suited for your child. And having these meetings and keeping that lines of communication open with your school is really vital in the success of your child in school and also your family. So that's what I would recommend, and just kind of doing research and also using the foundation's website as well. There's a lot of great information on the Epilepsy Foundation of America's website, lots of great information. Look at those resources, and that's my recommendation, is just to do research and homework, and it will help the success of you and your family.
I think the seizure action plan is the first step, and definitely any other additional resources, that's not a requisite. So the seizure action plan is definitely necessary. I'm not sure those other things are necessarily applicable for every single patient, because there are as many epilepsy patients as there are people. Everyone's experience is different, and so not everybody needs all of that documentation on hand, but the seizure action plan is essential for everyone, whether they carry the formal diagnosis of epilepsy or they've just had a seizure and they're being in the process of being diagnosed. Don't give up hope. Don't let it define you. It's mostly a treatable condition, and you should just always be asking, can we do better? You should always be striving for better. Strive for no seizures, no side effects. Our responsibility, you have to keep your doctors honest. You have to expect more of them and say, I want to live my fullest life, and you got to make sure you hold us accountable, keep us honest, because that's why we come in every day. We want to work with motivated people too, and so when you first get diagnosed, it may feel like it is a dramatic thing, but the way you feel right then and there is not the way you'll feel forever. So don't give up hope. You know, we're here. We want to work this out with you, and we're here for you through this journey.